I practiced surgery for about a little bit more than 20 years. And then I took an early retirement and I wanted to give back. I felt education, medical education, allied health education is one area where I can have an impact. I've really enjoyed that transition. I've been able to relate to the students, able to relate to the goals they have, the mission they have of getting into a medical field as an entry-level position and then progressing. And I'm able to provide them with, share my experiences with them on how they can progress. Once they start, they have opportunities with experience or education to grow in the profession. And as medical profession is growing, in technology is growing, specialties, more specialties are coming up. There's opportunities, a lot of opportunities. And I feel that I can have an impact on these future professionals, sharing my experience with them.
There are opportunities for our work and careers everywhere, if you know where to look. That's easier said than done, especially in our fast-paced and constantly changing world. Ann Faremouth is talking to experts, employers, and job seekers to bring you insight and understanding about what's possible. This is Career Can Do, where we're navigating the new work world.
Welcome to the Career Can Do podcast, a podcast dedicated to helping you navigate the new work world. My name is Ann Faremouth. I'm a recruiter, a multi-genre author, career trainer, corporate trainer as well. And today I am just delighted to have on my show a professional that's doing some wonderful things in the employment market. Dr. Aizaz is the campus director of a very prominent health school. He is the director of the Texas Health School, which was established in 2002. And since the pandemic, there has been a real demand for healthcare professionals. And this school is really doing some great things to help people facilitate this tremendous need. So without further ado, and after that long introduction, help me welcome Dr. Aizaz.
Thank you, Ms. Faremouth, for that nice introduction. Thank you.
Well, we are thrilled to have you here today and appreciate you taking time away from your busy position there. But Dr. Aizaz, I've heard so many wonderful things about your program, and I've talked to a lot of your students, and they seem so excited about, being a part of this great school. So tell us a little bit about the different curriculums you offer your students and the duration of those curriculums.
As you mentioned in your introduction, the demands of opportunities, workforce opportunities in the healthcare industry following pandemic, and even before pandemic, the Bureau of Labor Statistics is projecting a 16 to 20% increase in the demands for allied health professionals. Keeping our mission in mind, that's our goal, is to prepare future professionals in the healthcare industry. So we offer short programs, certificate programs, and we do offer a nursing program. So our short programs are medical assistant program, which is it's offered during the day as well as the evening shifts. So the day program is 32 weeks, evening program is 48 weeks. Then we do offer nurse aid program, which is a short program, a 4-week program, which will prepare students for working in nursing homes, taking care of patients, and then a stepping stone to be vocational nurses in future after completing the vocational nursing program. That brings us to the vocational nursing program, which we have at our campus, which is 48 weeks during the day shift, and it's a 74-week program in the evening shift. We do offer medication aid program, and we do offer a massage therapy program in the evening. And massage therapy program is about 45 weeks. So about a year-long program. And so we have a good mix of short programs and a little longer programs like vocational nursing with an aim of preparing students for employment in the fields of their study.
Well, that is wonderful. And does one of those nursing licensing programs, Dr. Aizaz, does that include an LVN program?
That is correct. It's LVN, a pre-licensure program. Students take their courses over 3 semesters during the day shift. And upon completion, they are eligible to sit in for the NCLEX PN exam, which is the practical nursing exam conducted by the Board of Nursing. And I'm pleased to announce we have excellent pass rates. for that program. Over the last 5 years, our results have been above the national as well as the state figures. So we are very proud of our faculty and the way the program is structured and run.
Well, that is wonderful. That is wonderful. And do you attribute that possibly to your class size, where maybe Dr. Aizaz, they get a little more personal attention and training? If this, sometimes if the classes are huge, people don't test as well when they do those certifications. Do you think the class size might have something to do with that or not?
To some extent, yes. It's a multi-factor endeavor here because, first of all, the curriculum. Our curriculum takes care of all elements of training. It has didactic component, it has a lab component, and it has a clinical component. And the students throughout the year experience whatever they are learning in class, they practice it in a clinical real life setting. And as they have been in clinical settings for about nearly 40 weeks, the transition from a student to a professional becomes very easy. So that's one factor. The other factor is the class sizes, as you mentioned, individual care. Our class sizes run anywhere between 15 and 20 students. We provide wraparound services, support to our students. So it's more of an individualized care. We offer academic help, tutorial helps, after class help, and the students can reach out to the faculty, the administration, the dean. They are available. They have open door policies. We are able to determine with the challenges the students are facing and trying to proactively assist them in addressing those challenges. So I would say it's the curriculum and class sizes and the individualized care we provide to our students, which is the reason behind their success.
Well, I think that's wonderful. And I'm happy to say that I had the pleasure of visiting quite a while with the dean. I thought she was a very impressive person. I have talked to some of your other people in the office at the school. It's a very welcoming environment. The school is a wonderful way for people to get a feeling about what they're going to be experiencing if they attend this school, because it's just a real positive environment and a really impressive school. And as I said, the dean was most impressive to me. As a recruiter, Dr. Aizaz, what I'm seeing is a lot of people are transitioning from one career to another. Many people during the pandemic, as you know, were laid off or downsized. I think that gave many people time to reevaluate, what do I really want to do? I think everywhere we look and we're reading or hearing on the television and the radio, it's about the great resignation. So many people are leaving their current jobs and reevaluating what they want to do. One interesting thing I thought about when I first visited with you was that you've done that in a way. You've transitioned. I mean, by profession, you are a cardiothoracic surgeon and with 20 years experience. So tell us a little bit about how that happened and how you got to transition your career and how you ended up where you are now.
So as you mentioned, I practiced surgery for about a little bit more than 20 years. And then I took an early retirement and I wanted to give back. I felt education, medical education, allied health education is one area where I can have an impact. I've really enjoyed that transition. I've been able to relate to the students, able to relate to the goals they have, the mission they have of getting into a medical field as an entry-level position and then progressing. And I'm able to provide them with, share my experiences with them on how they can progress. Once they start, they have opportunities with experience or education to grow in the profession. And as medical profession is growing, in technology is growing, specialties, more specialties are coming up. There's opportunities, a lot of opportunities. And I feel that I can have an impact on these future professionals, sharing my experience with them.
Oh, for sure you can. That's a real advantage for a student to have at the school they're attending is a director of the campus that has actually been in the medical area and not just an educator, because you know the real pros and cons and day-to-day kinds of experiences that a person in the field will have. So I think that's a definite advantage. I'm seeing as a recruiter, we're getting a lot more demands from medical people. So I do think that it is an area right now that has a demand. And I think that people that are thinking about transitioning into a career should definitely investigate this area, because I know for sure in the medical field, there's always going to be a demand for sure for nurses, but for the other curriculums that you offer as well. Also, doctor, after they take the classes and graduate from your school or pass all necessary exams, do you offer any career internships or placement assistance, or do you refer them to people, or how does that work at that point when they complete the process?
Yeah, we do provide career support, career services support. It's a lifelong support. Once I graduate, they can always come back. We have seen graduates taking a little break. They want to take a break before they get into the field. Some might take a year break, some might take a year, 2 years break. So we are always there to assist them, provide them with refresher courses, and also with the career support. We help them with resume writing. We help them with mock interviews. We assist them with completing applications, submitting applications, job applications. So our career services team and representatives are there to support our students. And it's not like it's a recent graduate. Yes, a graduate from the past can come back and we can assist them. We do have partnerships with a lot of facilities, and they seek out our graduates. They are reaching out to our career services department with job openings, and we do refer graduates who we feel will be successful in those positions. So it's an all-encompassing support we provide from day one till even after graduation to our students.
Well, I think that's wonderful. And I know when I visited with Dean, she did mention those affiliations that you have with medical facilities. That's a real advantage to have those affiliations, because once the students go through your process, then you have established relationships with facilities that have a demand for these type of people. So that, I think, is wonderful.
I'd like to mention one thing here as well. As I mentioned earlier, all our curriculums have a clinical component, and some of our students do get opportunities at the clinical facility they do their clinical rotations at. So that's a significant advantage of having a clinical component of a part of a curriculum, clinical component within the curriculum. And that helps students, gives an employer, a prospective employer, an opportunity to train a student, be comfortable with the student who has been training there. And then if they have a position open, they do offer positions to our prospective graduates.
Yeah, I think that's a tremendous advantage, because if the student can actually get a clinical, experience with the facility, I think in most cases they will get a job offer. And so I think to have not only the highly regarded educational training that you have available, but also once that is completed, to have these alliances and affiliations with these medical facilities, I think gives you a tremendous advantage. I just think the medical area right now is a tremendously hot area. I've been a recruiter for a long time, over 30 years, and I'm seeing more and more demands for medical people. And I do think there is a shortage of them. I do know that there is definitely a demand for nurses. So I think this school is a school that we're thrilled to put on Career Can Do, that people can know about what you all do and what programs you have available. And Dr. Aizaz, if somebody wants to get a hold of you, tell us about your website and the process. I mean, do they apply on the website, or tell us a little bit about how they can contact you?
Yeah, they can visit our website, which is texashealthschool.com, and they can leave their contact information, or they can call the school directly, and our admissions team will always follow up. If they fill out that information form on the website, our admissions team receives that information and they are able to contact the student. And we usually involve the student as well as the family, because we want them to make informed decision about going to school. We always take them on a tour. We let them visit classes, see the class in action. We even give them an opportunity, if they want to come in and visit our class for a day or so, take a detailed tour of the school and be comfortable that that's the program. And we do have our admission representatives who will explain all the programs, and then the student makes a decision which program they are interested in. Sometimes the students come in with the interest of their own that this is the program they want to do. So we always encourage the student to visit the campus along with their families, along with their partner, so that way they make an informed decision before they're getting into the program. Yeah.
Now, do you have curriculum starting at certain times of the year like other colleges, or do you have several programs a year? Or how does that all work as far as the start date and the timing? Does it all vary depending on the actual program they want to enlist in?
Yeah, our nursing program is a semester-based program, and we offer 3 semesters. There's a spring semester, there's a fall semester, and there is a summer semester. Other programs are on terms. depending on the length of the program. Some of them are on a 5-week term. Some of them are on a 6-week term, especially the evening programs. So we do offer classes year round, day and evening. And usually there's a start every month or every 5 weeks for the shorter programs.
We are just delighted to have the campus director on Career Can Do today. That is Dr. Aizaz with the very prestigious, prominent Texas Health School. If you are listening to this podcast and really thinking about what you want to do with your career future, and the medical industry might be a possibility for you, please do check out the Texas Health School. It's a very, very impressive educational program, and the people here are just really dedicated to helping their students become their best possible selves. So again, my name is Ann Faremouth. This is Career Can Do. And today we've had the pleasure to talk to Dr. Aizaz with the Texas Health School. So if you're driving and you didn't catch that website, please go to fairmouth.com, my website, and I'll have all the contact information on there as well. So thank you so much for tuning in, and we'll see you all next time. Bye-bye. We thank you for tuning in to our Career Can Do podcast. We make no guarantees on results for your particular quest, but we hope you enjoy the information presented. Thank you.